Do you know one of the most important mistakes massage therapists tend to make is not actually the technique they use, or instead is treating the diagnosis rather than the person. If a client comes in and they say, I have a disc bulge, or I have arthritis, spinal stenosis, I have a herniated disc, I have sciatica, immediately massage therapists assume they know what to do. But that's where the problem lies. These specific diagnoses do not mean these are the reasons that client hurts. If you're building your massage session on the diagnosis and the images and the MRI, not the person, you're not treating the big picture. If you're taking this course, you've already learned some of the spinal injuries and the disc issues and stuff like that. If you aren't taking the course and you're watching this on my channel, you can check out the other videos that precede this on spinal mechanics. And you'll learn a lot more about what's going on with the body and how to treat the client. Comes the most important question. How do we need to treat this client? Now here's the answer. Don't treat the diagnosis. Instead, treat what the client is presenting that day. That's why assessment is so important. Observe the movement, look for protective guarding, look for compensation patterns, and find what improves their comfort, what movements. As a massage therapist, we're going to help the movement. We're going to calm the nervous system. We're going to relax the muscles, which is going to help us recognize when someone really needs referral outside of what we can do. Changing this mindset is also important because you're not treating based on fear. I know they have a herniated disc, so I'm limited so much or something like that. Yeah, there's stuff you should avoid, but at the same time, you may not treat the person to the best of your ability if you feel that that's the reason they hurt when it could be something else. Client points to their lower back. Then the therapist spends the entire session on the lower back. But the pain itself, even if it's in the lower back, it doesn't tell us specifically where that pain's coming from. It tells you where it ended up. But for example, again, on sciatica, pain goes down one leg. Does that automatically mean maybe the piriformis right here is having issues? Not all the time. So you have to look at the big picture. Another example, what if someone has neck pain? All the muscles in the neck are a problem, or just one muscle in the neck are the problem? Not necessarily. Lower back pain. The lower back pain is caused because these muscles are being overloaded because the hips aren't functioning correctly. Maybe it's the reduced thoracic mobility is causing this to be overworked. Or maybe the nervous system is just protecting that area for some reason that we don't know of yet. Remember, pain is information. It's not always the source. The massage should include the painful area, of course, absolutely, and compensation patterns to see what's happening. Like I said, the big picture. If a client walks in, no matter what the spinal issue is in general, your goal is similar. Help muscle guarding, improve movement confidence, normalizing movement, improve the body awareness, know when the referral to something outside of your scope is appropriate. Notice if anything seems to be missing. Make sure you never try to say you're pushing a disc back in place, because we can't. Nor should we say it's our job to provide structural correction. It's more about improving function. Let's start with a disc bulge. A lot of people and therapists panic if they hear that word. They have disc bulge, afraid to treat. But did you know research has shown that a lot of people who have disc bulges don't have pain? They don't even know they have disc bulges until they get told. Don't always treat the MRI. Where's the client guarding the muscles? How are they moving? Are their hips stiff? Are muscles not activating? Is their spine in any part compensating? Are they afraid of movement, like bending or moving their shoulder or something like that? Those questions will actually help more than imaging itself. Let's talk about a herniation. Clients may have radiating pain, tingling, numbness, weakness. That's where a lot of therapists may find a big mistake. Let's say your massage reproduces symptoms down the leg. That's not a successful release. That could be a warning sign. Trigger point referral pain is different than me recreating a symptom from their injury. Our job, again, help at guarding, help improve movement, work within the client's tolerance. Another injury that a lot of either clients or massage therapists can be afraid is degenerative disc disease. Many of these changes are just because of age-related, and they're normal. Some people can have severe degeneration and have no pain at all. Others might have the opposite, which also applies to like osteoarthritis. Don't tell someone their spine is wearing out. Help them with movement and moving better and finding movement safe. They may be guarded because of their mind says that, or they were told they had something specific, and their mind says, okay, I need to protect that area. Maybe they don't need to protect as much as they're protecting. Remember, on sciatica, it's a symptom. It's not a diagnosis. Instead of thinking, okay, they have sciatica, we need to know why they have sciatica. What's happening to the body? Sciatica is just the irritation of that sciatic nerve due to something. Could be lumbar disc issue. Could be stenosis, nerve root irritation, and sometimes the piriformis. Don't automatically chase the glute. Instead, you need to observe. Are they shifting weight? Is one hip elevated? Is one glute weak? Are they avoiding a certain leg? These compensation patterns are going to tell you a lot about why they're in pain. Did you know that positioning may actually be more important than your technique that you utilize? Sometimes side lying is best. Sometimes having braces of pillows. Sometimes extra bolster. Pillow between their knees. Pillow under their stomach when they're face down. Maybe avoiding lumbar extension. If the client can't relax in the positions, your massage is not going to be effective. Before every treatment you're going to do, ask yourself these things. One, of course, is this client medically cleared to get a massage? Is their situation severe enough that we need to make sure they have clearance? Are there any red flags happening? What movement increases symptoms? What movement decreases symptoms? Are they local or are they radiating? Are they protecting? What compensation patterns are present? How can I safely calm their nerves and muscles today? Unless you chase the diagnosis, unless you chase the pain, find the source, assess the client properly. When you find the source and address the client correctly, helping the nervous system feel safe again, that's where lasting change often begins. Hope you're enjoying the spinal mechanics series. You can check out the other videos that are connected to this one on the same playlist. And if you have any questions, comment below, or if you're not taking the course right now, if you're interested in the CEU course, it'll be in the description. Thank you so much for watching. Please share, save, and subscribe.